I'm going to tell you about a kind of language learning impairment called Specific Language Impairment, or SLI for short. This is a kind of difficulty with understanding of language, learning language, and with talking. Now, children who have specific language impairment can do well at other kinds of activities, for example, sport, music, making things, art, and making friends. SLI is something of a puzzle. It's not caused by a hearing loss or by a physical disease. Most children who have SLI have difficulties with talking, so with putting words together in spoken sentences, and these are called expressive language difficulties. Some children have difficulties with understanding what people are saying, and these are called receptive language difficulties. Receptive language difficulties often aren't obvious, but a child may only be picking up the odd word here and there and may not be fully understanding what people are saying. There are many different aspects of language that can be affected in SLI, and a speech and language therapist can assess a child to identify exactly what the difficulties are. Some children have difficulties working out the meanings of words, and they may get confused if people use long or more complicated vocabulary. It may be difficult for a child to understand longer or more complex sentences. And some children have difficulties called word-finding difficulties. This is where they know a word and they know the meaning of a word, but they can't remember it and can't access it readily. Children with specific language impairment tend to talk in simpler sentences and may miss off grammatical endings of words. For example, saying, "Yesterday I play in the park," rather than "played in the park." Some children with SLI also have difficulties with speaking clearly, so their speech may sound immature or difficult to understand. If a child with SLI has these kind of speech problems, these often improve as they get older. Because there are no obvious symptoms, SLI is a hidden disability. Children with SLI sometimes can't respond to the things that people say, and if people don't understand what their difficulties are, they can perhaps think that they're being lazy or misbehaving. It's really important, therefore, that we pick up if a child has a specific language impairment. Also, it's easy to assume that if a child has difficulties talking, then they're going to have difficulties with doing all other things, when in fact children with SLI often have talents in other areas, and it's really important that we support children to develop these talents and progress in areas where they can have success and achieve. If you'd like further information on SLI, you can follow the links on our page or watch any of our other videos.